What? Remember when I had diarrhea last week? I was like the Energizer Bunny. I kept going and going and going.
In our last talk about diarrhea, I indicated it is not an emergency in almost all cases. Warning signs that need a doctor's input are bloody diarrhea, severe pain with walking or jumping or touching the stomach, or no peeing for 12 to 24 hours. Now, even though there's not really much to do about it, a lot of people go to the emergency room anyway with vomiting and diarrhea symptoms, and they sometimes end up with a prescription for a medicine to stop these symptoms. I want to warn you that one of these medicines is not safe for kids. Zofran, or ondansetron, is a medicine that stops vomiting, but vomiting is important in a child. And if a child vomits for 3 days with no diarrhea, it's always a medical emergency and should never be masked by a medicine that stops vomiting. Remember, it's very important not to stop vomiting in a little kid with anti-vomiting medicine, because it'll hide a very serious problem. Other medicines, like anti-diarrhea medicines, loperamide, also known as Imodium, are also not recommended for little kids, as they prevent the toxins from getting out of the system by stopping the diarrhea. And Pepto-Bismol, which is bismuth subsalicylate, it's a derivative of aspirin. It turns the poop black, also not recommended in little kids. One of the ways to slow down diarrhea for a child that has the stomach flu is to minimize milk intake. Obviously, we're talking about kids over age 1. Perhaps you can change to a soy milk or a rice milk just for a little bit of time, and this can sometimes slow things down. Also, the brat diet, bananas, rice, apples, and toast. Remember, apple juice causes diarrhea. And toast is just a bread or bread product of any kind. These kind of things thicken the poop and often make it a little easier for a child who has diarrhea. Also remember that if you give red-colored foods or liquids to a child, you might confuse them because it'll come out red and you might think it's blood. And you don't want to do that because you don't want to end up in the emergency room for a reason that you shouldn't be there. I'm Dr. Watson. Now I gotta go.
I'm going to pass on the pudding.
In a world where disclaimers are boring, one man opts for something decidedly different. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.
Don't forget to subscribe to our channel on SnoozeTube
And remember to like us on Facebook.
and Tweety Bird.